This is hepatitis A, B, C, D and E. So A, choti ungli, is small little finger, is for the children. Hepatitis A occurs in kids. So you will never forget it. It comes by food, contaminated food or water, and you ingest and the liver gets the insulting virus, it swells up and has jaundice. The second important is E. Adulthood, mature, you get hepatitis E, and this is also a virus which is by food, water, contamination and all that. It is an epidemic. E means think about epidemic form of virus. Affects pregnant women, other people. So now knowing about A and E are foodborne and waterborne. Now what about the other three? The hepatitis B, C and D. Hepatitis A is very interesting disease. Did you get hepatitis A? I'm sure you would have had it. All Indian children have it. When you are a small kid, you get hepatitis. You said, "Sir, childhood में मेरे को jaundice हुआ था." हुआ था? नहीं हुआ. You must not have noticed. So almost 90% of Indian children would have hepatitis A because it comes from school. Unless you are carrying your water bottle with you and you are not eating out at all, you are so hygiene conscious. Maybe you are, then you may not get it. But most people in villages, cities will have it. It's a silent disease. When it comes, it has advances like fibrosis, cirrhosis, liver cancer. So of all the patients with hepatitis B, about 1% to 5% get liver cancer every year. Hepatitis C, 2% to 5% get liver cancer. This is a WHO target for 2030 that birth dose coverage should become 90%. Are you immunized or vaccinated?
On behalf of Voice of Healthcare to one of our special initiative where we raise awareness on public health issues. Today, as we mark World Hepatitis Day 2024, with this we aim to raise awareness on this disease. On the special occasion we have our guest Dr. K Sarin. Sir does not need an introduction, but just for the sake of this interview and the formality which we have to do for public, I'll introduce Sir. Sir is the Director of Institute of Liver and Biliary Sciences, President of National Academy of Medical Sciences, a clinician, a gastroenterologist, hepatologist, and also a Padma Bhushan awardee. Welcome to our show, sir.
Thank you, Simran. Thank you for inviting me.
Thank you so much, sir, for taking out time for this special initiative to raise public awareness on health issues. We know the amount of work you have done in this. Your dedication of preventing and treating hepatitis is a commitment which is shown to all public out there. Your campaign like Yellow Ribbon campaign with Enroll to Hepatitis Vaccination Program exemplifies your commitment for this role. Thanks a lot for this, sir. I would like to start the discussion with you by knowing and letting us know our audience about what exactly is hepatitis. What are its symptoms, treatments available, side effects? We want to know in layman terms, and you are the best person to tell us about that.
Well, thank you, Simran. And Simran is a very familiar name. It looks like a name from the movie DDLT. And Shreya, thanks for coming over all the way and being part of this public awareness. So let me first start with the Yellow Ribbon campaign. Now, we were trying to raise awareness about hepatitis B, and I got a mail in 1998 from two girls. One was in class 7th and one was in class 9th from Mumbai to join a international conference which we were doing. And I was intrigued. I said, why these young girls and the students are coming? Of course, their mother was a doctor. So these girls came from Mumbai, all the way traveled in the train in the night, and they brought 2 ribbons for me, and that time Jethmalani Sahab was there as the law minister, one for Ram Jethmalani. So they pinned it on, and I asked the incentives, and just like, and I suddenly realized that the student community is amongst the best community. They get ideas brighter than any one of us, and therefore on the same day we got 600-700 yellow ribbons made, and that was the launch of the yellow ribbon campaign in Delhi about 15 years before the WHO. The WHO World Hepatitis Day is July 28th, started in 2010 on the birth of Dr. Bloomberg, who discovered hepatitis B. But we started this campaign of yellow ribbon of hepatitis awareness in 1998 thanks to those two girls, and that is on December 4. December 1 is AIDS Day. December 4 is the day where Delhi has been celebrating, or rather observing, Hepatitis Awareness Day. So this is the story, and I think the yellow ribbon signifies jaundice, the liver in some way, and I am very thankful that the government of Delhi supported and we continued. But why are we talking about all this? It makes a difference.
Yes.
It does make. In 98, when the yellow ribbon campaign was there, we had Dr. Harshvardhan as the Delhi's health minister. He took it to the President of India, Dr. Narayanan, who said, wearing a cap, I may show you some of those pictures, hepatitis is an important problem and we should try and get rid. Sheila Dikshit ji was Chief Minister, Delhi, and Delhi became the first state in 2001 to launch the newborn vaccination program on 15th August 2001, followed one day later by Sikkim. And that was the journey that started. And then the Planning Commission, Dr. C.P. Thakur was the health minister, and the public awareness, Atal Bihari ji released a stamp. And what I am saying is, these observations of these days does make a difference in the minds of public and the policy makers.
Yes.
Now your question on hepatitis and why we should do about it. So let's look at these 5 fingers to all the viewers. Shreya, are you seeing them clearly?
Yes, sir.
Yes, he is our cameraman, he is a trainee, I'm told, in the Trinity College, and Shreya is with us. So 4 fingers, 1 thumb. This is hepatitis A, B, C, D and E. So A, choti ungli, is small little finger, is for the children. Hepatitis A occurs in kids. So you will never forget it. It comes by food, contaminated food or water, and you ingest, and the liver gets the insulting virus, it swells up and has jaundice. The second important is E. Adulthood, mature, you get hepatitis E, and this is also a virus which is by food, water, contamination and all that. It is an epidemic. E means, think about epidemic form of virus, affects pregnant women, other people. So now, knowing about A and E are foodborne and waterborne. Now what about the other 3? The hepatitis B, C and D. The B, you all know, is generally mother to baby. Almost 95% is mother baby. Hepatitis C is generally injections and others. So both B and C are by body fluids and by transmission from man to man or woman to woman. And D is a virus which piggybacks on the B. Hepatitis delta, as it is called, only occurs when hepatitis B is there. Now everyone, you know about the coronavirus?
Yes, sir.
Which type of virus is it? RNA or DNA?
RNA.
Everyone knows now RNA, DNA.
Yeah.
So let me tell you, hepatitis B is a DNA virus.
Okay.
Hepatitis C is an RNA virus. RNA viruses are very fragile. You put them into temperature and the virus dies in a very short time. But hepatitis B is a DNA virus. It survives. It will survive Delhi heat, 50 degrees for weeks together. It will survive your refrigerator for maybe minus 80 refrigerator for a week or two. It never dies. Why I am saying this? If you have a hospital where there are patients who have got blood and they are infected with hepatitis B and their blood is now on the railing on somewhere, then the next person comes, healthcare worker or a patient who has a cut. He has his hand there and you can get the infections there. So hepatitis B is a very sturdy virus. It is, unless properly sterilized, the virus doesn't die, and therefore everyone, healthcare workers, have to remember it. Then your question was about what are the symptoms and how do these viruses occur. You know, Gandhiji said if you slap, you put your things. What body does in hepatitis B, the slap it takes is the virus comes, but body accepts it because it comes from mother to the baby. Like you get your nose, you are an army officer's daughter, Air Force officer's daughter, as you told me. So you get all those genes from your parents. So these things, the virus also comes from mother and the baby's system accepts it and it doesn't revolt. What does it mean? If you get hepatitis B from mother and the baby has it, the rest of the life the body accepts it at its own. The body does not fight, it accepts. Now what does it mean? These people will remain silent. So it will be a silent killer for ages. So how do you know whether this patient is going to develop disease? Why are some people developing disease? That's a different story. But the mode of transmission is mother to baby generally, and it remains silent. So all those who have ladies who are likely to deliver, they should all be tested for hepatitis B and think that everyone is infected. Think. So every newborn must be vaccinated so you can protect. But now let's see those who have got hepatitis B over a period of time. Let's say 20 years, 30 years. Now body says there is something funny. We must get this virus out. And the activity starts. We call it immune active state. Till then it is immune tolerant state. We tolerate. But 20 years, in some people 15 years, in some people 50 years, the immune active state starts. The people get jaundice and they may get problems. And out of 100 people, 10 will have immune active injury state. The remaining 90 may continue. Now those who get immune active state, 1 to 10% of them will develop cancers and others. But even immune tolerant can develop. So hepatitis B is a disease which is because of a DNA virus, it persists, and most often we come to know about it when you have symptoms, and symptoms are in the form of jaundice or swelling or advanced liver disease. Now hepatitis A and E both are acute viruses. जैसे आपने खाया, आपको लूज मोशंस हो गए, आपको बुखार हो गया, तो similarly hepatitis A and E will cause symptoms, and maybe 4 to 6 weeks after you have taken something funny, then you get loss of appetite, sometimes you have vomiting, nausea, and then you get jaundice and other things. But hepatitis A is a very interesting disease. Did you get hepatitis A?
No, sir.
I'm sure you would have had it. All Indian children have it. When you are a small kid, you get hepatitis. You said, "Sab childhood में मेरे को jaundice हुआ था." हुआ था? नहीं हुआ. You must not have noticed.
I don't remember.
So almost 90% of Indian children would have hepatitis A because it comes from school. Unless you are carrying your water bottle with you and you are not eating out at all, you are so hygiene conscious. Maybe you are, then you may not get it. But most people in villages, cities will have it. And this spontaneously goes away. 4 or 5 days, like any viral fever, hepatitis A goes away. But if you get hepatitis A in adulthood, maybe after 25-30 years, then it is a serious disease. Then it can cause liver failure, severe jaundice, itching. Sometimes people even need liver transplants and all that. And same is true of hepatitis E. It's an acute infection. Suppose there is a rainy season like this,
Yes.
so there is some excreta from an infected person, all the people will get infected, the whole village. Like Kanpur had like 70,000 people. Delhi in 1956 had almost 40-50,000 people who got hepatitis E. So now with the better quality of water, sanitation, hygiene, we don't get hepatitis E, but if it is there, it is a serious problem, especially in pregnant women. So now you know all about hepatitis. Now hepatitis C. Hepatitis C is by needles, injections and blood. Before 99, India was not testing. The virus was discovered in 89, and from 99, most blood banks have started. So now our blood is generally safe. It doesn't have B, it doesn't have C. But for people who got blood transfusion, and I want all of you to who are listening, please remember, please accept this. Those who got blood transfusion, surgeries, operations, heart, coronaries, or any procedure before 99, do get your tested for hepatitis C, because there was no such testing. Now fortunately we are safe, but if you are hepatitis C positive, you have remained, it takes 20 to 30 years before disease occurs. It's a very slow disease process. So, oh, what happens? I have got hepatitis C. But if you have got it, get tested, get the RNA done, like for corona, it's an RNA virus. So, if you have got it, you have to get it. It's a silent disease. When it comes, it has advances like fibrosis, cirrhosis, liver cancer. So, of all the patients with hepatitis B, about 1% to 5% get liver cancer every year. Hepatitis C, 2% to 5% get liver cancer every year. Have I told you everything?
Everything, sir.
All right.
The kind of information we got from you is, I think now it's clear to all our audience what exactly is hepatitis, types of hepatitis, and how it gets transmitted, most importantly.
Yes.
So I think we are aware of hepatitis now. So moving on to my next question. We know how extensively ILBS is working.
So before ILBS,
So-
let me tell you more about hepatitis
Sure,
B,
sir.
because this is important. See, hepatitis B is transmitted from mother to the baby. What India needs is to ensure that the babies are protected. So in India, the coverage for a birth dose vaccine is just about 40%. We need 4 dosages of vaccine for the newborn at birth within a day, 24 hours, at 6 weeks, 10 weeks and 14 weeks. So everyone, please remember, 4 dosages are required, and this is a WHO target for 2030, that birth dose coverage should become 90%. In India, most deliveries are institutional, 79-80% are in the hospitals or dispensaries or so. But our birth dose is only 40% or so. So what I want to urge is that everyone who delivers a baby must certainly get, the newborn baby must be given the vaccine. And the vaccine is so good. The corona vaccine, there was so much debate.
Yes, sir.
अच्छी है, खराब है, ये वाली लेनी है, विलायती लेनी. Hepatitis B, no such questions. It is so effective. If you give it to the baby, lifelong protection. It's almost 100%. And the advantage is it is cheap and it is given free by the government. Even if it is not available, sometimes you are far off. What happens? 500 rupees or 1000 rupees, so vaccines. Are you vaccinated?
I believe so. बचपन में जो पूरा vaccination course
नहीं,
होता है-
hepatitis B. नहीं ना, पता नहीं है ना?
No, not
So this is the important thing. This is, are you vaccinated, Shreyas?
Yes, sir.
So first question, are you immunized or vaccinated?
Okay.
So the difference between immunization and vaccination I want to explain. Vaccination is not equivalent to immunization. Immunization means I have antibodies. जब आप कोविड के टीके लगवाते थे और साहब मेरी एंटीबॉडी लेवल इतनी अच्छी है, you understand? But in hepatitis B, everyone who gets the newborn will be immunized because they have no other problem. But people who are drinking alcohol, obese or diabetic or maybe above 50 or healthcare workers and others, in them immunization is only in about 90-95%. 5% are not there. So remember, all of you should get antibody level done once, especially healthcare workers, that I am immunized. Number two, healthcare workers, doctors, nurses, they think, oh, nothing can happen to me. They are just not careful. So I'll give you some data that healthcare workers in Delhi especially, only 40 to 45% have all three dosages. In adults you need three dosages. 0, 1 month later and then 6 months later. Why do we give this gap? Because body's cells get used to. How do we make a hepatitis B vaccine? Let me tell you. One portion of the virus, the surface protein, is taken and antibodies are raised. So when you get a vaccine, it is a very teensy part of the protein of the virus. You give it, body thinks it is hepatitis B, it makes antibodies. So when you get a vaccine, you are protected. So in hepatitis B, unfortunately, healthcare workers are not so well vaccinated. So my message on this hepatitis day is, you will not touch a patient. My dear healthcare workers, you will not touch a patient unless your antibodies are enough. It means you are immunized. It means your antibody level is above 10. But it is always better to have a bank balance. So keep your antibody level above 100. If it is not above 100, get another shot. Be strong against hepatitis B. And then you can tell your patient, look, I am immunized against hepatitis B. Hope that makes a difference.
A lot, sir.
One last thing on immunization. Everybody should get hepatitis B vaccine. It is a myth that only children should, newborn should get it. Tomorrow, suppose you need a blood transfusion, you need a surgery, then you can't get immunized, you need 6 months. You have a knee problem, you have a fracture, somebody, not you, then it is always better that every single adult has been immunized against hepatitis B. Whatever is your age, maybe you are 80, still take it, doesn't matter. So you at least know this deadly virus which kills almost 1.3 million people across the world. I am not going to die due to hepatitis B, neither my friends nor my relatives. Is that right?
Yes.
So let's take a pledge. On 28th of July 2024, all healthcare workers will get their immunization levels above 100 antibodies, and all Indians, adults, will get their vaccination complete, and all newborns will be having 4 dosages of hepatitis B vaccine, including birth dose. That's right?
Yes,
so
sir.
we have a pledge now.
We had
All right, we will work on this.
Yes, sir. And I think the impact these vaccinations actually make on global level to people, it helps us eradicate the disease from the root.
Yes, you are protected.
Yes.
See, how do you eliminate a disease? How do you eliminate?
Like,
one, those who are infected, remove, get the virus out of them, treat them. Second, those who are likely to be born, protect them. So if you protect all newborns, the next generation is healthy. All those who are infected, and there are 29 lakhs, approximately 3 how much is 3 crores is how much? Is 30 million.
Yeah.
Almost 30 million Indians are with hepatitis B. It used to be 4.5 crores, now it is about 30 million is the estimate. And if 30 million are suffering from this, if you treat them, this is the pool. These are the infected people, but they don't know. only coverage for treatment, only awareness or detection in India is about 15%. Of the 30 million, only 15% have been detected. 85 don't know their status. And of those who are detected, 3% have been treated. So imagine a tennissim, how can you eliminate a disease? So through you, through this voice of health care, we would like everyone to do the following. The following means whenever you go to a hospital or on your birthday or on your health checkup, get hepatitis B tested. If you are positive, unfortunately, get treated. It is not you who have got the virus. You got it from your mother. Mother got it from her mother. So don't get scared. Number 2, all those who have infection of hepatitis B already, their family members must get tested. Simple logic. अरे भाई माँ से मुझे मिला तो मेरी बहन को भी मिल सकता है, मेरे भाई को भी मिल सकता है, मेरे चाचा को भी हो सकता है. All the relatives in the family should get hepatitis B testing. Normal percentage may be 2%, 1% of hepatitis, but in the family it can be 20%. So immediately we find out all those who are infected. Now we have to treat them. So don't be scared. Now the problem is the stigma. हेपेटाइटिस बी है, उसकी शादी नहीं होती, नौकरी नहीं मिलती. मैं सही कह रहा हूँ, गलत कह रहा हूँ? आई मीन दे आर मार्जिनलाइज्ड. मिथ इन देम. बट व्हाई इज द मिथ?
कि ट्रांसफर हो जाएगा.
हाँ, वो कैसे होता है? बिकॉज यू क्लब इट विथ HIV. People think this is sexual transmission. Hepatitis B, this fellow must have done something wrong. The wife is not very pure. The husband is something. So this social stigma prevents people to disclose, prevents people to accept. They can't tell to their bosses in their workplaces, they can't tell to their wives. If the wife tells to the husband, the wife is sent home. So what I want to say, do not punish people who are already punished in a way because they got it. You can't choose your mother, you got it from your mother. What can you do? So one of the messages is that we should have a kind of empathy with them, and we run a campaign called Empathy, empowering people against hepatitis. We are running it from 2018. It's a program which I feel happy. It used to be done in the Parliament of India for last 4 years. Every year they do in Parliament. It is just to give the voice to the people, to confidence to the people. You are not at fault. You are same. We should embrace them with warmth. And to detect those who have hepatitis B, I would recommend all of you to get tested. Anybody who is going for any surgery or anything should get tested. All the family members, those who have got dialysis or those who have others, should also get tested. So if you know the pool of infected, treat them. Finished. Those who are getting born, if they are protected, you can eliminate hepatitis. It is simple, and I think if the understanding is clear and the society, whole of society approach is there to accept them, support them, the leaders are bold.
That's great. And like sir said, it all comes from the understanding, the awareness, which we are doing with the help of Dr. Sarin, to raise awareness about hepatitis. And there is no need to be scared of that it will be transmitted like a way. If you're working, you're eating together or something like that, everything has a solution. Get it vaccinated, get it eradicated, get it eliminated from your body, and slowly and gradually your country will eradicate hepatitis B, and it will impact on global level as well.
Yes, we will. Thank you.